Good morning. My name is Melinda Godfrey. I'm a nurse practitioner and the program manager for the STD Center of Excellence. We are based out of the University of Rochester Infectious Diseases Division and Center for Community Practice. And I have with me...
Thank you, Melinda.
You're
I'm
welcome.
Scahill. I'm a nurse practitioner also with the Center for Community Practice, and we are funded by the New York State Department of Health Clinical Education Initiative to be the Center of Excellence for STDs for the state. And we're going to talk about anal health.
So a lot of anal health is focused around men who have sex with men. And today we really want to focus on women who have anal sex and heterosexual anal sex. So first I want to talk about the epidemiology. New York State came out with information recently that talked about over the last 4 years we've had increases in gonorrhea and chlamydia, and over the last 8 years we have had increases in syphilis, and over the last 2 years we've had increases in congenital syphilis. So STDs are a concern, and we want to make sure that if you're having anal sex, you're keeping safe. One statistic out of New York City says that 1 out of every 2 people under 25 years old has an STD, and one of those STDs could in fact be syphilis. And if you are a woman of childbearing age, you have to be concerned again with congenital syphilis and passing that on to your baby. The CDC, their epidemiology says 2.3 million cases of gonorrhea, chlamydia, and syphilis were what they reported in 2017, and that's the 4th consecutive year of increases. And they reported 1.7 million cases of chlamydia. That's a 22% increase since 2013. Now, we looked at New York State's reporting of condom use. From 2013 to 2015, condom use has decreased in high school students. So we kind of have a gap there. We need to figure out how we can keep students safe when they're having sex, and we're going to talk a little bit more about how maybe you can do that. I'm going to turn it over to Maureen now.
Thank you. Well, as Melinda said, we want to focus on anal sex in the context of anal health, and it isn't just about MSM, although those are the majority of the people that get tested for rectal infections. We do know that there's been a dearth of research on this for many, many years, and while over the past 10 years there's been an increase in some of this information, we still don't have a lot of good solid data. But 2 recent studies, one in Baltimore at the STD clinic there, among heterosexual men and women, they talked about and looked into the prevalence of anal sex. And what they determined is that if rectal testing for gonorrhea was not done, 30% of their cases would have been missed. And likewise for chlamydia, 14% of their cases would have been missed. And another paper from 2017 of heterosexual women, 28% of the infections were associated with anal sex. The infections would be gonorrhea and chlamydia. And 40% of the HIV infected infections were associated with anal sex. And that's been shown in other studies in New York City and in Ohio and Minnesota. So we know that rectal infection occurs. We know that it occurs in both men and women who are receptive anal sex partners.
So with rectal infection, let's talk about that for a little bit more. Often it's asymptomatic, but nonetheless, with an infection in the rectal area, whether it's chlamydia, gonorrhea, or syphilis, you still have an infection there, and it still is infectious, and you're still transmitting it to your partner. So you need to have it treated. The recommendation for testing is every 3 to 6 months, and that's dependent on the level of risk. And let's talk about risk. What does risk really mean? Risk means are you with many partners? Are you receiving rectal sex? And that's regardless of whether you're using a barrier. The rates of extragenital infection will increase among HIV positive partners more than HIV negative partners. And then risk is also associated with transactional sex. And then we're both going to talk about condom use.
So I'd just like to interrupt and say that the guidelines about testing every 3 to 6 months are pretty firm for MSM, whether or not they're rectal receptive and whether or not they use barrier. That doesn't mean we're saying barriers are useless. It's just that that's what has been found in both case studies and also population studies, that we need to continue to test the anal area if the person is an MSM or a woman who is rectal receptive. So
thank you. Yes, I
so
forgot
let's
to
talk
mention
about
that.
condoms, because we do endorse them.
Yes. So female condoms, they are non-latex. They can be used for anal sex, and they make an excellent alternative for using a male condom. And there's a ring inside of the female condom that can be used to help insert it into the rectal area, and it can help put it past the anal sphincter. And what you need to make sure is that plenty of lube is used. The female condom comes with a lot of lube on the inside and outside of it, but to make sure that there's no additional friction or pain associated with it, you need to make sure that you're using more lube.
Especially on the inside.
On the inside.
Where the friction would likely be mostly occurring.
And what else about that, the female condom, did I?
Well, the female condom has not been endorsed by the CDC as an absolute protector for anal receptive sex, although it is for vaginal sex. It was originally developed as a birth control device, so it hasn't been well studied in the context of infection prevention. Nevertheless, the New York State Department of Health does endorse the use of the female condom for rectal sex, and the CDC says it's probably useful. It just needs more information. And Melinda mentioned the ring inside and how that helps with insertion. That's whether it's used in the vagina or the rectum. But some people use it for rectal sex, choose not to use the ring inside, which does challenge the insertion. Excuse me. But one way that some people insert the female condom into the rectum is to put the condom on the male's penis, as opposed to the female's penis, on the penis, and insert it that way. And just got to make sure that it's in correctly and all of that. So that's another way to use it. We did get a question once we started talking about female condoms about whether or not the FDA has approved them for use in anal receptive sex, and it has not as of now, but there was a flurry of looking into it a few years ago, but it is currently not approved that way. Consider that with the comments I already made.
So let's talk a little bit more about healthy sex before we close out today. So young females are choosing to have anal sex for many reasons. They like to have anal sex, or they want to preserve their virginity and they want to avoid pregnancy. It should always be pleasurable, and it should be pleasurable for both parties. It should never hurt. The key to this is always use plenty of lube. Lube is your friend. And if you're concerned about maybe having a bowel movement during anal sex, some people like to use a glycerin suppository about an hour prior to anal sex, which will do two things. It can stimulate the anal sphincter, and you may have a bowel movement prior, and it will also lubricate the anal sphincter. A good thing about the glycerin suppository is it is water soluble, and a couple things: you never want to use an enema or a rectal douche prior to having anal sex. And Maureen, do you want to add in anything to that?
No. The rectal douching is a habit a lot of people have, particularly MSM, because they think that's what women do with the vagina. But as we know, no douche is a good douche, and so we would generally say not okay. Certainly prior to anal sex, inserting things like enema tubes or douche implements can irritate the anus and the anal canal as well as the rectum. And finally, we're really running low on time, we want to just remind people about the importance of what we call extragenital testing. That means testing besides in the genital urinary system, or the vagina and cervix in the woman, or the penis in the man. And so, Melinda, you want to tell them what that means and why, what they need to know when they're in a health visit.
Yes, so as a clinician, you want to ask your patients the types of sex they have. All you want to know is where to put the swab for testing. Never assume, ask every patient. And as the patient, be honest with your clinician. They just want to know where to put the swab to test you and keep you safe. And at CEItraining.org, we have a lot of courses online. You can find out more about how to take a sexual history. You can find out general STI testing, diagnosing, and treatment information, as well as courses on cultural competency. And we hope that you have a great day and keep safe.
Thank you.
Thank you.